Just see if anybody is standing outside. Well, namaste. You can also wish me namaste. I always say that namaste is perhaps the best expression that you could find in terms of greetings, because it covers good morning to good evening, good night, welcome, as well as goodbye. It also has a very, very beautiful meaning that let me bow in front of that which lies within you, your soul. So namaste once again. I'm very happy to welcome you all here. This is, as you know, part of our series called Media India. Basically, it's meant to reach out. We have a vision that the consulate should become an effective bridge between India and the US, and we should try and build as many partnerships, as many collaborations, as many friendships, as many networks as possible through our power of goodwill. That's the objective. And true to this spirit, we have today something that is actually already enhancing the goodwill among the people on this planet. This is a subject close to the heart of all, basically a holistic lifestyle. How do we live in today's very, very complex, complicated and demanding world? So the traditional medicine and its relevance and potential is the topic for this evening. We have earlier had more political, or you can say that subjects that dealt with relations at a different level. But I think for the first time we have a topic that is relevant to each of us. We believe that the civilizational wisdom of India really lies in giving us a holistic view of life. That man cannot be separated from the nature. Man cannot be separated from other human beings, other forms of life, be it animals, be it insects, be it water life. We are part of one holistic being, and our health essentially also connects us. Our body connects us, our mind connects us, our spirits connect us with everything that is there, not only on this planet, but perhaps everything that is in the universe. Now, how do we understand this in a very simple terms? Perhaps yoga opens the path for us to reach that understanding. It's said that yoga karmasu kaushalam, which means the excellence in action means yoga. Now that action doesn't really mean your action in life, but it really means your view of life, the way you live, the way you look at yourself and the universe, everything that is around you. So without much ado, I would like to welcome our distinguished guests, our distinguished speakers this evening, and both of them are perhaps the most deserving experts on this subject. We have the speaker is Dr. Shwendu Sen, Director of Medical Education and Associate Program Director of International Medicine Residency Program at Raritan Bay Medical Center, New Jersey. He is a diplomat from the American Board of Internal Medicine and holds double Master of Science Research degrees. We have given you the detailed bios of both our speakers, but Dr. Sen is a fairly, very outstanding personality, in the sense that he believes in propagating a holistic view of life. He is a recipient of the New York State Senate Award for his contribution towards education and medicine. He writes for eminent newspapers like Times of India, and he is founder and director of Project Access, a voluntary organization centered toward health for uninsured people. Similarly, the moderator is equally distinguished person, Dr. Ronald Renner, Director of the Behavioral Health Service Line for the Catholic Health System of Long Island. He is Doctor and Clinical Professor of Psychiatry at SUNY Downstreet Medical Center, and has extensive experience in teaching residents and medical students. He is also President and CEO of Neurobehavioral Research NBR in CEDARS, a company dedicated to the development of new medications in psychiatry. Welcome both of you, and thank you for joining us. Thank you all. Our next month's lecture, or rather speech, is by Dr. Mr. Aziz Hanifa. He is the Managing Editor and Chief Diplomatic and Political Correspondent of India Abroad, and he will be speaking on the topic of ethnic media and their role, and its role in promoting India-US relations. So those who are interested, please look at our website and do convey your interest to us. Everybody is welcome. Consulate is an open place, open space, so that we advance these conversations to bring more friendship amongst our people. Thank you very much. Enjoy the evening, and now I hand over the floor to our distinguished speakers after the evening. Thank you.
All right. Thank you very much. I'd like to thank the Indian Consulate for extending its invitation to Dr. Renner and myself. I'd like to thank the Consulate General, Mr. Mule, in particular, for starting the initiative and a wonderful endeavor to start these very delightful discourses that has been happening for the past few months. I was there in one of the past events. We had a great experience, a great exchange of ideas, and which was the whole purpose for this endeavor, and I'll commend you for the efforts. Today we are talking about traditional medicine, its relevance, its potential, its implementation, its tremendous promise in today's society. And we're talking about India. One of the prime reasons is India formed a major civilization during the formative period of the world. And not just in India, we're looking at Chinese civilization, Korean civilizations, and they contributed immensely during those times. But even before we start talking about medicine, give me a minute and a half to talk about the word tradition. And again, this is my personal perspective. We kind of look into this word in a slight negative connotation, as if this is something which happened in the past, it's locked up there where it should stay, with no connection with the present times. And I find it very redundant. If you look into the expressions of life that we have now, music, sports, literature, science, none of them were born last night. They were not born yesterday. If you trace back their roots, they all took place about many hundred years back. They were all there. Music was there. Science was there. It was all there in a different shape, in a different expression, different manifestation. It was evolving, but the essence was there. So as far as I'm concerned, there is a continuity. with the past and the present. And traditional doesn't have to be the opposite of contemporary. So we got this propensity to think that this is contemporary as opposed to this is traditional, as if both of them are in isolation. We give an exclusivity to these two terminologies, which I think is erroneous, quite redundant. So there is a continuity between the two. We'll keep this thing in the back of our brain as we move along. A very famous British poet, Rudyard Kipling, once said, actually he wrote, "O east is east and west is west and never the twain shall meet." A quick look into the world outside and you will know how dangerous it is to pass a judgment. For in today's shrinking world, the east is blending with the west. The north is blending with the south, and the whole world has now become one big platform, one amphitheater where all performers are performing side by side. Not necessarily harmoniously, because there are conflicts. That's okay, that's the name of the game. You would want to have differences. Unless you have the differences, there's no exchange of ideas, there's no progress. Having said that, in medicine we have a challenge. In mainstream medicine, I don't like to use words like Western medicine as opposed to Eastern medicine, because in today's virtual world, they're all one and the same. In mainstream medicine, what we do is that we have to drag everything under the microscope. We've got to see it. We've got to feel it with our palm. And only then we're able to say, this is a documented care. This is as opposed to the thinkers and the proponents of traditional medicine who would say, wait, some things are so big, some things are so comprehensive, they are so subtle, they are so slender, that you cannot really tame them and drag them under the microscope. You cannot really film them into a slide and say, hey, this is what it is, because it is difficult to see them as much as it is easier to feel them, almost like music. You know, sometimes we say about music, like music is something to be felt and not to be understood. So here we have this quintessential fight between a qualitative virtue on one side and a quantitative gain on the other side. But we cannot deny the fact that we have reached a stage of visibility where no land is that far away from us. So there is a continuity between these two. And today our objective is to see whether we can cherry pick the best of these two powerful forces, mainstream versus traditional, and see whether they marry each other, whether they can walk hand in hand, whether they can serve the humanity better, whether they can make the world a better place to live in. So, traditional medicine coming from India rests on one big pillar, fulcrum, the pivot, and that is meditation. And coming from meditations are some subsequences, some consequences. Yoga is one of them. Ayurvedic medicine is one of them. Music is another one. So we'll start by talking about meditation. Having said that, we're not going to talk about them in isolation. I mean, I'm not a certified yoga teacher, right? I'm a physician, so I'm a licensed MD and I practice medicine. What we're trying to see today is to see whether this meditation / yoga / Ayurvedic medicine has any relevance in today's world. Are they contributing? Yes, they are. But that's what we will see tonight. So let's start with meditation. I hope this is going to work. You've got to realize something, that I was born and raised in a country where every god of any religion stands and sits in a meditative pose, where this giant of a word called meditation casts its spell on every alternate meaning. I mean, you're looking at words like happiness, peace, serenity, bliss, contentment, even eternity. They spin off of this giant of a word called meditation. So it's quite natural that we follow many meditative techniques to get our feeling of relaxation. But we'll boil down to 2 or 3 of them, and we'll take it from there. Now, I would like to start with a quote. And there's a reason why I'm starting with this quote. A, because of the personality, and B, because of the quote itself. Of all the major personalities that has been identified by this country as who made a substantial contribution to this country in terms of philosophy and thought process, including Joseph Pulitzer, Benjamin Franklin. It is Swami Vivekananda, not just because of his back-breaking lecture that he gave in 1893 in Chicago, much more than that. He brought yoga to the West. There was a time when it was considered to be the gateway between the East and the West. But more important than the personality is this particular quote. Education is the manifestation of the perfection already in man. If you take off the word education, the rest of the sentence is exactly what Indian thought process stands for. You can call it spirituality is the manifestation of the perfection already in man. Intellectualism is the manifestation of the perfection already in man. And it is applicable in all walks of life, including today's relevant topic, which is medicine. So in other words, if we have a disease, it is not just enough to treat the devil that caused the disease, but it's also equally important to journey inwards and reach to that stage of perfection and fix it. Fix that imperfect mode into a perfect mode. Now we have different terminologies that we use. In medicine we can call it immunity. So on one hand, we are going to treat the disease, we are going to treat the symptoms. On the other hand, we are going to journey inwards and fix the immunity, which might have been disturbed, which was probably the beginning of this disease process. So with this, we will start talking about meditation. I don't know how much you can see. So, as I said, we have innumerable meditation techniques. We are bringing it down to three major. What we call as a mindfulness meditation, a concentrated meditation, and somewhere in between, transcendental meditation. Now, I'm not going to define this, because I've noticed the more I research, the definitions, they change. What doesn't change are the examples. So I'll give you an example. In mindfulness meditation, it's like you're looking at a field, a vast expanse. You're looking at it, but you're not noticing it. You're doing exactly the opposite of what Sherlock Holmes wanted his partner, Dr. Watson, to do. Arthur Conan Doyle's very famous detective serial, right? So, very famously, Sherlock Holmes told Dr. Watson that it's not enough to look, but it's important to notice what you look. In mindfulness meditation, you're doing just the opposite. You're not going to notice what you look. You're just going to be like an observer. You're observing this expanse without any judgment, without any analysis. One is instantly reminded of a famous Persian poet, Rumi. He once said, "Beyond life and beyond death, there is a vast expanse. I will meet you there." Now you can look at these lines in any number of ways you like. And if you want to call it an introspective poem, it's an introspective verse. If you want to call it a romantic, of course it's romantic. It's soft with romanticism. But if you feel in between the words, if you feel in between the syllables, this is exactly what mindfulness meditation is all about. You want that expanse, because after death you cannot have a structural expanse. It's all potential. You want this potential expanse to feed inside you. And you get this relaxed feeling of awareness. This is as opposed to concentrated meditation, which is kind of like a Western adaptation. Sorry for the terminology. In concentrated meditation, you are concentrating on something. You're concentrating on a source of light, you're concentrating on a flame, you're concentrating on an object, and as the Buddhist monks would do, you concentrate on your own breath sounds. But eventually, the result, the outcome, the denouement is the same. You get this heightened awareness of relaxation. Somewhere in between this mindfulness meditation and concentrated meditation, you have this transcendental meditation, hugely popularized by Dr. Deepak Chopra. So in transcendental meditation, you have a mantra. Now, some of us who may not know what a mantra is like repetitive words or notes or hymns, and you recite it. So since you're reciting it, there is some concentration. But then again, you're reciting it without any attachment. So that's mindfulness. So transcendental meditation is a little bit of mindfulness, a little bit of concentrated meditation, but again, the results are the same, the objectives are the same, which is enhanced relaxation. Now, here is the challenge. Now, one of you from the corner can stand up and say, you know what, Dr. said, I practice meditation and I get these feelings of serenity, bliss, peace. And I'll say, thank you very much. But can I use your feelings of relaxation to the benefit of another human being? Because unless I can do so, I may not be able to acknowledge it as a universal form of therapy. I mean, you've got to realize that at the end of the day, we are physicians. We are in the business of saving lives. So when you are saving lives, opinions are dangerous. You've got to stand on firm facts. So here is the challenge. Can we convert this subjective feeling into an objective benefit? Can we quantify meditation? Can we quantify these periods of relaxation? To put it in short, can I prescribe meditation? So that's the challenge that we have at this moment. So what I'm going to do, I'm going to highlight one or two landmark experiments that we have done here, scientists have done here, to prove that yes, meditation is one of the prime modes of the treatment of human suffering. We'll move on to the next slide. So this is the evidence-based medicine that we are talking about, something which is known as a state. State means any change of your mood. You're in a state of happiness. You're in a state of serenity. You're in a state of peacefulness. Now when that becomes a habit, that becomes a trend. You may not be doing active meditation, but since you've been doing it for such a long period of time that you have become an individual who has become very calm and composed despite the stressful stimuli that you have, that becomes your trend. So here comes the challenge. Can I grasp this trend through our modern imaging techniques, through what we call as the other tests that we do, let's say the EEG? This brings me to this doctor, Dr. Hans Berger. If anyone can be called as the father or the godfather of unified medicine, and this is my own personal terminology, this traditional and modern medicine united together, if anyone to my mind can be called as the godfather of unified medicine, then it has to be Dr. Hans Berger. He's a German psychologist slash neurologist. Interestingly, I was going through his all the paperwork. I could not find a single line of praise for this man from any one of the students. He was a very disciplined, very astute physician who did not want to be pretty in front of his students. All that he did was to work on his research work. He is considered to be the inventor of electroencephalogram. Just as we have an EKG, we have EEG of the brain. And an electroencephalogram, through the electroencephalogram, we find that there are certain waves in our brain. It's an irony of sorts, it's a tragedy of errors that nobody recognized his work and he died. He actually took his own life, a very bitter man. But then again, that's not surprising. I've seen that geniosity is only appreciated after you close your eyes. The other day I was studying with my son, and he was doing Emily Dickinson, the famous poet in the United States. She has a huge cult following, and I found out that during her lifetime of 55 years, only 2 of her poems saw the light of the day. So it happens. This is a trend. Now, Dr. Berger came out with these waves. So we found out that there is a beta wave. It's a beta wave when you are very excited, when you are in an active mode. And then you have what is known as alpha waves, when you are more relaxed. And then when you are more dreamy, more meditative, you have a plethora of theta waves. And when you are sleeping, you have the delta waves. He did not stop at that. He did another experiment. He had a set of people, healthy individuals, their eyes were open. Then you had another set of people, healthy individual, their eyes were closed. And he put electrodes and measured the waves. And he found, lo and behold, that those who closed their eyes had a much higher amplitude of alpha waves. And when they came out of the experiment, they actually said they were feeling much more relaxed. So think about it. They were not even meditating. All they were doing was to close their eyes and shut off the visual stimuli. So when I'm looking at you, it's a distraction. It's a good distraction. When I'm looking at a street and there is a car accident, it's a bad distraction. But at the end of the day, there is a distraction. So when you close your eyes and you have what we call as an inward contemplation, the alpha waves get triggered. And you get this high amplitude of these alpha waves. This particular experiment, conducted in 1929, broke the dam. What happened afterwards was nothing short of a deluge or a flood. Cut to 21st century. And this is what is happening now. We are having what is known as an alpha technology. Quite some time back, a few weeks back, I was discussing with Dr. Nina Rajay. She's here in the audience. Apart from being my mentor, she's the director of the integrative medicine. And she gave me some literature on alpha technology. And it's mind-blowing. What they're doing now, they're actually through ear clips, they put electrodes, and they're passing microamperes of electricity, and they're actually stimulating the alpha waves. They're giving alpha waves as a formal treatment of depression. These are procedures which are FDA approved, adopted by many countries in Europe, and is considered to be a standardized treatment of depression as an adjunct to the drugs that psychiatrists will give. This is where we stand right now. I'll just give you, let me see whether I have. So this is the heightened, the alpha waves that you see when you close your eyes. I'm talking about the lower panel. A little bit about where they work. Now, I'm not going to give you a mouthful. I'm not going to flood your brains with gaudy details of the anatomy of the brain. But suffice it to know that there are two areas of the brain which pretty much represents the functional status of a human being. One is the prefrontal cortex, and the other one is the hippocampus. And it has been found that increased alpha waves in these two areas induces this period of this prolonged relaxation, right? There was actually a very cute experiment that was done in London. They did it on London taxi drivers. So they measured the neuronal activities of the left hippocampus of the London taxi drivers before they started using GPS. And they used, once they started using the GPS, they measured their hippocampal activities again. So GPS is when you're actually following somebody blindly. Like somebody, a voice tells you, drive 300 feet, turn right another 400 feet, make a hard stop, and you do that. And they actually found that the hippocampal activity was 3 times that of the normal before the advent of GPS, as compared to when the GPS came. It was totally blunted. So this is where and there are many, many English words for that. Use those phrases, right? Use it or lose it. To rest is to rust. So this is where we stand, where we have now identified areas in the brain, the prefrontal cortex and the hippocampus, where heightened activity of the alpha waves not only increases your concentration but gives these feelings of prolonged relaxation. And this is the alpha technology, and if you see the third one from the left, that's your heightened alpha activity that you get. We'll move on from meditation to yoga. I mean, for the sake of time, obviously I cannot spend so many time with each one of them. But this sets the stage, the perfect stage, the perfect template for the discussion of yoga. Now what you see here is neither a cartoon nor a caricature. It's actually a Mithila painting. For For some of us who may not be familiar with the Indian school of painting, it's called Mithila painting. It's from Bihar, and very talented artists. They don't use sophisticated brushes. They use their fingertips. They use the broken nibs of a pen and some blotches of paint, and it's become an internationally renowned and accepted painting. But to come to yoga, this is a practice that has been practiced for thousands of years. Yoga introduced a brand new concept of mind and matter. This exotic union of the body and the mind. So with yoga, we have a physical